To everybody at Mental Health Australia and the broader mental health community, led by Leanne Begley, but all of you, our psychiatrists, our psychologists, our counsellors, our leaders, our organisers, this has been the hardest of years. Perhaps the hardest since the Second World War. Drought, flood, bushfire, and of course, the pandemic. And that's meant immense stress. Whether it's the lockdown, whether it's the fear of illness, whether it's the immense economic impacts and the unemployment which has had such a profound effect on people's lives, mental health has been under stress around the country. So this budget invests significantly in mental health. And whilst the highlight is, of course, the doubling of the Better Access Psychological Services from 10 to 20 sessions in response to the Productivity Commission draft recommendations, it's a beginning. It's not the end of the process. And so to look at where we've come from, during the course of the year, we've invested over $70 million in response to the mental health needs of communities that have suffered from bushfires. We've invested over $500 million in response to the pandemic and its mental health impacts. And that's included over $74 million with regards to support services for communities through Lifeline and Kids Helpline, our work with Headspace, our work with so many others. All of these things are immensely important. The pandemic mental health response plan, a world-leading plan. And this is your work. And I want to thank you for it, for Christine Morgan, for all of our leaders that have assisted in this space. But then, more than that, we've had to support the Victorian community in particular. The establishment of 15 Head to Help clinics. An incredible achievement, and you did this. Yes, we helped support it, but you did this. So then that brings me to where we're at in this budget, knowing, of course, that telehealth has been a revolution in mental health support. It's not just provided coverage during the pandemic. It's brought many people who would otherwise not have gone face-to-face into consultation with their medical professionals for mental health reasons. And that's been a revolution, a breakthrough. It was a decade's reform delivered in 10 days initially. So in this budget, it's a $5.7 billion investment this year alone. It's an increase of $485 million in new programs over the course of the budget for mental health. And in particular, we've listened and we've responded to your recommendations and the Productivity Commission's recommendation for a doubling of Better Access Psychological Services from 10 to 20. And that's a really significant step forward. It's an investment of just over $100 million. But it's not the money. It's the knowledge that where help is needed, help will be provided. And that will add to the support right across this nation. $64 million for suicide prevention over and above what's been added. Funding for trauma support. Funding for assistance with the Way Back program. All of these things matter. But then as we look beyond the budget, the final Productivity Commission report will be tabled by the Treasurer in the coming weeks. We're already responding to the recommendation in the draft report. Going beyond that, there'll be that system work and design as we move together to respond to the final report. There's the work of the National Suicide Prevention leader in Christine Morgan and the Mental Health Commission. But all of you will come together as we add to what is in this budget. Now our task is to deliver very significant funding, almost $500 million of additional funds, $5.7 billion of funds in this budget alone, the doubling of better access psychological services. These are real actions. We have a nation that needs new support, and we know that for so many people, the other great element of this budget, of job creation, of getting people back to work, isn't just about economic support. It's about mental health support. It's about dignity. It's about confidence. It's about helping to reduce anxiety and to give people all of the hope which comes from employment or the prospect of employment. So these things come together, and I want to thank everybody at Mental Health Australia and everybody in the mental health community for your leadership with hard, tangible projects, hard, tangible programs announced in this budget. And I want to wish you the best, and I want to commend you for your work in helping to save lives and protect lives and support the mental health of Australians.